Short answer is yes. The longer and I think more doctory answer is that no treatment is without risk. So kind of a trick question. What do I mean when I say that? Well, with TMS, I don't worry about those common systemic side effects you might see from medications for depression, like fatigue, weight gain, sexual problems, the list goes on. There is no chemical component to TMS. It's not in the stomach, bloodstream, liver, or kidneys. It's not attaching to unintended receptors all over the body. Instead, TMS stimulates the brain directly, and it's that stimulation that might cause issues. The most common issue is some discomfort at the scalp or the upper face. This is because the scalp is full of tiny nerves. Now, those nerves have nothing to do with depression, but they're in the way of our magnetic field, and they get stimulated just the same, causing small muscle contractions. Sometimes the movements are even visible. The most important thing to say from my point of view is that this is expected and not dangerous. It varies in intensity from people who say, you know, Dr. Poole, I stayed up all night, worried about this is nothing, to people who say, ow, okay, you're right, can we lower the power? We can and we do. You being comfortable is a major priority. Along the same lines, we monitor for any headaches during treatment. These are caused by overuse of those small muscles, like when you give yourself a headache from straining your eyes. If they happen, they're usually isolated the first week or two and they're mild. A little bit of ibuprofen in time goes a long way. Like an MRI, TMS clicks. Can you hear that? As the magnet cycles. In clinical trials, we have patients wear hearing protection just in case, and we recommend the same here. We provide you with a new set of earplugs every day if you wish to wear them. We promise to turn the TV up if you can't hear it. Seizure is one of the scariest, but also rarest potential side effects from TMS. With proper screening, modern devices, and standardized protocols, this risk is estimated to be very low, something like 0.0003%, so not expected to happen to you by any means. Still, we think it's worth screening for, telling you about, and preparing for, just in the rare event that it might happen. Finally, like any treatment for depression, even when symptoms are improving, it's always important to monitor for any negative changes in mood, thinking, or behavior. These are fortunately also rare. One of the best features, I think, of our clinic is the ability to see and monitor patients daily. If concerned, we can always just take a break from TMS and simply assess where you are. Next, what can I expect during treatment? So we're gonna show you, hopefully. I've got Trevor coming in as a patient, and I will extend the chair here into the TMS mode.
And I just want to let everyone know that this is for demonstration purposes only, and NeuroStar TMS is by prescription only. So, you know, what we're going to be demonstrating here is a motor threshold.
NeuroStar Advanced Therapy is by prescription only. This demonstration is for training purposes only and not representative of an actual prescription MT. Patient prescriptions, outcomes, and experiences will vary. The most common side effects include temporary pain or discomfort at the treatment location and/or headache. There is a rare risk of seizure, less than 0.01% per patient. Please refer to neurostar.com for full indications, contraindications, and important safety information.
And what your patients can expect. So I'm excited. I've got my MT cap. I've already got on and ready to go. So maybe you could explain what the MT cap is for.
Yeah, I sure can. Okay, on your first day, let me hang this up. On your first day of treatment, your physician will map you. This is where myself, staff, and the patient work together to make sure that 100% of the treatment is delivered at the right location, depth, and dose. I will admit, Trevor's wheels have been greased a little bit. We already have some idea of where his motor cortex is from earlier. If we didn't, no big deal, probably would take a few minutes and maybe you'd be bored. Okay, what we're going to do is, machine is definitely on. We will start.
You guys can come closer too and see if you can see my hand move.
Here, where we think his motor cortex is, and we'll fire some pulses there looking for movement in his right hand. Remember, left motor cortex, right hand. If it works like it should on the brochure, it would be a movement of the index finger or thumb, sometimes a perfect pinching motion like that. Let's see if we can get something. Okay, I think you're already seeing it. Again, we cheated a little bit, but I think you can already see it. Okay, so we're getting the nice movement of the hand and definitely some of the thumb and index finger, just like we saw earlier. Are you able to see that, you think? Oh yeah, we can see it. Okay, just wanted to make sure that the audience could see what I was talking about. All right. Once we locate this landmark area, we'll do some functional testing to determine the correct power level, and we'll save these measurements from Trevor's chair, his head, and the coil into our computer system here. These measurements will stay the same throughout treatment. They help to maintain the positional integrity. We'll then move to a few centimeters forward to our actual treatment area. That's the dorsolateral prefrontal cortex as promised. When treatment begins, pulses will fire faster. That was the snapping I was doing earlier. They come at 10 beats per second or 10 hertz. We stimulate for 4-second intervals with 11-second breaks for 3,000 pulses, and up to 120% of this initial power level we'll find here. This protocol comes from decades of research on the best way to stimulate this target area. Finally, I just want to talk about, we'll get this off of Trevor for a moment. Sorry.
Yeah, that's great.
What kind of care can I expect to receive, right, during and after TMS? Personally, I follow with patients pretty often. I want to do that early in treatment to make sure that they're tolerating treatment okay, but I also want to do that periodically in more formal visits. During these visits, my job is to compare symptoms from our first interview to symptoms now. What's better and what's left? We'll also take a look at survey scores the patients complete each week and use data points to make smart adjustments to treatment, maximizing your opportunity for benefit. Finally, after you complete TMS, we'll follow up at least one more time. We'll talk about final results, how best to target any remaining symptoms, and how to maintain good mental health for as long as possible. Okay, Trevor, give us a scoop. How do you feel?
I feel great. I feel like normal, but I mean, it was just a light tapping. You know, but it made my hand move, so it's fun science. But I do have to ask you one question. Do I have to wear the cap every treatment?
No, you can if you wish to, but you do not have to.
I don't have to.
In fact, everybody gets a new cap, so you can take it home with you, go swimming, go to the shower.
Awesome. So tell me